There are new rules for fit testing of respirators. This short program explains the new rules and procedures for proper fit testing of respiratory equipment. These new standards have established new filtering efficiency and performance criteria for all non-powered, air-purifying particulate filter respirators. The purpose of fit testing is to make sure the respirator you use will not leak under normal use and working conditions. Almost any respirator you use will appear to fit, but individuals wearing a respirator may not always be able to detect a leak. Therefore, a good fit testing program is necessary. The new standard allows respirator users to continue using and purchasing air purifying and particulate filter respirators certified under the old standards. Before an employee may be required to use any respirator with a negative or positive pressure tight-fitting facepiece, the employee must be fitted with the same make, model, style, and size of respirator that will be used. The employer shall ensure employees using a tight-fitting facepiece respirator pass an appropriate qualitative fit test or quantitative fit test. Fit testing a respirator determines the quality of the respirator to face seal and is the only way to screen out poorly fitting facepieces. A fit test should not be confused with a fit check or user seal check. The fit check or user seal checks are used only to verify that a respirator is seated properly before a fit test or before entering a work area with a previously fitted respirator. The two basic types of fit test are quantitative and qualitative. You can remember the difference between the two by remembering the word quantitative or quantity. Quantity in that something must be measured with an instrument. Quantitative fit testing provides a numerical or scientific measurement of the respirator fit. It is the most accurate type of fit testing. Quantitative fit testing is performed by challenging the seal of a probed respirator equipped with P100 HEPA filters to a challenge aerosol that is easily detected by the fit test instrument or by measuring the pressure inside the facepieces during a controlled negative pressure fit test. The words challenge aerosol refers to approved materials such as smoke or other aerosols that can be detected by a human being. A probed respirator is one that has a probe inside the respirator for measuring pressure. The challenge aerosol material is something that is not harmful, but it can be easily detected with sensitive instruments. A fit testing instrument will monitor the aerosol concentration both inside and outside the facepiece during this test, or the instrument will calculate the pressure differences between the inside and outside to determine if there is any leakage. Next, the instrument will either report these concentrations or calculate the wearer's fit factor. A fit factor is the ratio of the concentration outside the facepiece divided by the concentration inside the facepiece, or a measure of the leakage rate. While this fit factor represents the actual fit of the respirator in a test environment, an assigned protection factor, or APF, is a limit set by an applicable regulatory agency. When the assigned protection factor and the fit factor are compared, the fit factor must exceed the APF by at least 10 times in order for the fit to be adequate. Let's say that again. When the assigned protection factor and the fit factor are compared, the fit factor must exceed the APF by at least 10 times in order for the fit to be adequate. This means you need to know and understand assigned protection factors, or APFs, to make sure you have a proper respirator for the potential hazard. For example, a half-mask respirator has an assigned protection factor of 10. Therefore, the wearer must achieve a fit factor 10 times greater than the APF, or 100. This safety factor may be set higher at the discretion of the respiratory program administrator. A probed respirator is a respirator that has been modified by the manufacturer to provide a sampling port through which internal air can be monitored. This probed respirator can only be used for fit testing and can never be used for respiratory protection. Another practical alternative is a fit test adapter. This adapter allows the conversion of a working respirator to be fitted with a probe. An advantage to this procedure is the wearer can be fit tested in his or her own respirator. Qualitative fit testing is not accurate and merely provides a pass-fail result without obtaining a numerical or scientific measurement. In this type of test, the respirator's facepiece to face seal is challenged with a substance detectable by the human senses, such as smell or taste. The test subject is relied upon to provide an unbiased and honest response. Since the test subject is the person who will be detecting the smell or taste of the testing material, pre-screening is necessary to demonstrate an ability of the person being tested to detect the test agent. A qualitative fit test would be extremely unsatisfactory if the person being tested could not detect or smell the testing material. Every human being is different. Some people have very sensitive senses, such as some people can detect a very minor odor, while another person would have to be saturated with an odor before they could smell it. That's why qualitative fit testing is not scientifically accurate. But it does have value in helping respirator wearers evaluate whether the respirator they'll be wearing will protect their health from potential hazards. The qualitative test only verifies a protection factor of 10. If more protection is required, then a quantitative fit test must be performed. During the qualitative fit test, if the person's senses detect the substance inside the facepiece, the respirator being tested fails the test. Commonly used aerosols and testing substances include irritant smoke and Bitrex. These materials are designed for the safety of the person being tested and for the strength of the test material for proper detection. Although passing a qualitative fit test only verifies a protection factor of 10, this type of fit test can be used to comply with the new fit testing requirements for all tight-fitting facepiece respirators up to a protection factor of 10. Some disadvantages of qualitative fit test protocols is the subjectivity of the test, as well as lack of information on the magnitude of the respirator leakage. Other limitations are the ability of the subject to detect the test agent and the type of response it elicits. The only recourse in overcoming these limitations is to perform a quantitative fit test with scientific or numerical measurements. Regardless of which test is used, fit testing of tight-fitting atmosphere-supplying respirators and tight-fitting powered air-purifying respirators must be accomplished by fit testing in the negative pressure mode. Fit testing must be accomplished in the negative pressure mode. General requirements. The first requirement in fit testing is to allow the wearer to pick the most acceptable respirator from a sufficient number of respirator models and sizes, so the respirator is acceptable to and correctly fits the user. These sufficient numbers of models do not have to be from different manufacturers. Proper training must be provided relating to donning, doffing, and adjustment of tension straps on the respirator. If a person is not familiar with these procedures, additional training in donning and doffing must be provided. The person should make sure the respirator fits comfortably, including the position of the mask on the nose, room for eye protection, room for talking, position of the mask on the face and cheeks, chin placement, adequate strap tension, proper fit across the nose bridge, proper size to span the distance from the nose to the chin, and tendency of the respirator to slip. A mirror must be provided to evaluate fit and respirator position. During the fit test, the test subject will perform various exercises to determine the effectiveness of the fit and seal of the respirator. The tested person should perform as many different exercises that would closely relate to respirator use in a normal working environment. Depending on the type of test, these may or may not include normal breathing, deep breathing, turning the head side to side, moving the head up and down, talking, grimacing, bending over or jogging in place, and normal breathing again. These exercises are performed in the above order for 1 minute, except for the grimace exercise, which is performed for only 15 seconds. The objective is to perform enough exercises to demonstrate that the seal of the respirator is satisfactory for normal, routine respirator use. Proper fit testing is an important element of any respirator program. No matter what else you do, if a respirator doesn't fit properly, it's useless. The standards require fit testing on all tight-fitting face pieces, including air-supplying and powered air-purifying respirators. Fit tests are required annually and after a significant change in the type or model of respirators. Also, fit testing is required if there is a physical change in a person, such as weight gain or loss, facial scarring, cosmetic surgery, substantial dental work, or other factors that could affect the wearer of the respirator. There are other conditions of respirator use that can affect the fit. Nothing must interfere with the seal of a tight-fitting respirator, including facial hair and glasses. If beards are trimmed so they do not break the respirator, this is acceptable. However, the fit test shall not be conducted if there is any hair growth, beard, mustache, or sideburns which cross the respirator sealing surface. In the example shown here, would this person be allowed to fit test or wear a respirator under this condition? The answer is no. There's facial hair stubble that may interfere with an appropriate seal between the face and respirator. There must be a proper seal before anyone may be fit tested or wear a respirator. Seal checks. Each time a worker puts on a respirator, a user seal check is required. These seal checks are not substitutes for fit testing. Exactly how do you perform these seal checks? A positive pressure check is performed by closing off the exhalation valve and exhaling gently into the facepiece. The face fit is considered satisfactory if a slight positive pressure can be built up inside the facepiece without any evidence of outward leakage of air at the seal. A negative pressure check is performed by covering the inlet opening of the canister or cartridges and inhaling gently so the facepiece collapses slightly, and you hold your breath for 10 seconds. If the facepiece remains in the slightly collapsed condition and no inward leakage of air is detected, the tightness of the respirator seal to the face is considered satisfactory. The purpose of fit testing and seal checks is to make sure there's a proper fit and seal without any leakage inside the respirator. Fit testing and seal checks are mandatory. Documentation. The respirator plan requires extensive employee training in all aspects of respirator use, selection, fit testing, maintenance, and, of course, the respirator program must be written. Documentation of all training, testing, repairing, and maintenance is required. One of the more important parts of the respirator program will be if employees can answer some of the following questions. Has your respirator been properly fit tested? Do you know the proper procedures for selecting respirators? Have you completed the medical questionnaire and a health professional evaluated your health to ensure you're able to wear a respirator? Do you know how to properly conduct a seal check? Have you been trained in the various aspects of respiratory protection? Do you know the capabilities and limitations of respirators? Do you know how to properly care for and maintain respiratory equipment? Can you recognize the signs and symptoms that may limit or prevent the effective use of respirators? These questions will help evaluate the effectiveness of your company's respiratory protection program. Of course, appropriate surveillance shall be maintained of work area conditions and degree of exposure or stress. When there is a change in work area conditions or exposure, the employer shall reevaluate the continued effectiveness of the respirator. After employees leave a respirator use area, they should wash their hands and faces and respirator face pieces as necessary to prevent eye or skin irritation associated with respirator use. Naturally, if the wearer experiences any difficulty, leakage, changes in breathing resistance, the respirator must be cleaned and tested. If the respirator is defective, it must be repaired or replaced. Proper maintenance, cleaning, storing, and inspecting of respirators is an important part of the respiratory protection program. The use of respirators is simply one method of helping protect the health of people working in environments where their health could be affected if this protection were not used. If respiratory protection is not used or used improperly in these environments and conditions, then the worker's health could be impaired. It's up to the company to provide the training, equipment, and maintenance. The most important element of the program is the wearer's responsibility in following the rules and regulations established by the company. The respirator wearer's attitude toward safety and complying with the standards will make the difference between an effective program and a less than effective program. Protection of your health is the goal of the respirator program. Thank you.